The Obama administration is launching a new campaign to promote the benefits, the broader benefits of the president's new health care law. Joining us on 710 KURV with some commentary, Senior Research Fellow, Health Policy Studies at Heritage Foundation, Edmund Hazelmeyer. So, what do you make of the president's new offensive, his new initiative to try to get the benefits of health care out there? Do you think he has enough material to work with?
Well, as Yogi Berra said, it's kind of deja vu all over again. I mean, good grief. We're now in the fourth year of new offenses to sell this, dating back to the fall of 2009 when they still hadn't passed the bill and people were very upset about it, flooding congressional town hall meetings. And what did they do? The president went out and made a speech. They tried to tinker with some of the provisions of the bill to show that it would benefit people, and it was all a PR offensive. And, this has been going on for 4 years. Every time they have these problems, they roll out another PR offensive. It's not about the marketing; it's about the product.
But is there
and,
is there is there
and that's what they've
substance
got to
there?
perform on.
Yeah, but is there substance for the president to, for example, the college students that can stay on mom and dad's plan till what, age 26 or something like that? The folks that had pre-existing conditions that are now able to purchase some type of insurance for themselves and then eventually their family or something like that. There's got to be somebody that he can pick up the phone and call and stand behind him.
And that's what they're trying to do, trying to find. And they have found some of those people. I mean, it's virtually impossible to do something this big, this complicated, and this expensive without benefiting somebody. But that's not going to solve the problem, because now they're in a situation where they're actually hearing from people who've discovered that they're going to be worse off. And, we just know this about human nature. I mean, people who are worse off are going to be more upset than the people who are better off and are happy. And it also happens to be that the numbers seem to be bigger with the people who are worse off.
Now, on the opposite end of that, why is it that the GOP leadership lacks the testicular fortitude to call up the doctors who are retiring early, leaving the practice because they're not going to mess with Obamacare? How about bringing the folks that have lost the insurance that they were promised they could keep and the doctors they could keep? How about bringing the folks that are having to pay more for their insurance premiums? Why does this leadership not call those people to stand behind them at a press conference to show America the mess that Obamacare is?
Well, they may very well. I don't know. I mean, these are politicians making decisions about what provides them with good visuals for making.
You know what John Boehner's approach is? John Boehner's approach is to call this the bill. The bill. It's law, dude, and you're not going to get it repealed anytime soon. They lack imagination and creativity. Seriously, they need to call up some PR firm to give them some tips on how to sell their political points.
Yeah, and that may be the case. But, I mean, again, both sides of this, whether it's the Democrats in the administration or the Republicans, the problem for the American people is it's not about their messages and counter messages. It's about the reality of what do I do next month.
Yeah.
And that's what is really going to make a difference here. Are people better off or worse off?
Joining us on 710 KURV to talk about the president's new push to sell Obamacare, Senior Research Fellow at Heritage. He's an expert in health policy studies, Edmund Hazelmeyer.
Mr. Hazelmeyer, Tim Sullivan here. And yeah, I don't often agree a whole lot with my co-host over here, but Serge makes a good point. Republicans, they're doing a lot of chirping. They're doing a lot of yakking and yelling, but that's it. And I guess I'm wondering why are conservatives and Republicans continuing to bash the Affordable Care Act without offering, on paper, an alternative bill? Doesn't that kind of undercut their efforts?
Right. Well, first of all, there have been some alternative bills offered. The Republican House Study Committee did offer a bill in the fall that was fairly comprehensive. I reviewed that. Secondly, there is this distinction between folks like us and myself who are policy experts on the outside and the politicians and the political advisors on the inside, who we can give them all the information they could possibly ever use, and we can advise them how to do it, and we do this all the time. But that doesn't, it's like, you can lead the horse to water, doesn't mean the horse is going to drink. Now, from our perspective, we've got 25 years of published papers on exactly how to do things and how to do it better in great detail on our website. I mean, just the things like I published a paper. You can go look it up on heritage.org under my name back in, let's see, it was June of 2012.
Okay, so why aren't Republicans gathering your information, putting it all together in a single bill, and getting it to the American people?
Yeah, you have to ask them. I mean, we do this stuff. We put it out there. We certainly send it to them. We are happy to go meet and greet them. And by the way,
okay, so what does that say to you about the Republican leadership then, if they're not willing to go, as far as the Reince Priebus's or the Ted Cruz's think they should go on an alternative bill?
Well, again, I think this is a problem that you see in both parties is image over substance, and a lot of it's driven by the campaign consultants. I mean, look, you can criticize Republicans, and I think validly so, for being more image than substance on this, but you can also come and criticize the Democrats, and that's how we started this off. I mean, the administration and the congressional Democrats who passed this are absolutely dead set against any substantive, meaningful changes to it. They simply want a PR battle to try to sell the product. And the problem
where's that going to get them?
Well, I know, but look, that's my frustration as well. I mean, I'm a policy person, and that's part of why I'm a policy person and not a political guru, because I'm actually more interested in the substance than in the messaging and the selling of it. But the reality is, it frustrates me as well. I mean, I've had times when I've worked with both Republicans and Democrats very constructively. And interestingly enough, I find more success doing that at the state level than at the federal level. But, that's the way it is.
All right. Edmund, thank you for your time. He studies health policy at the Conservative Heritage Foundation, Senior Research Fellow Edmund Hazelmeyer, joining us on 710 KURV.